Good afternoon, Dr. Dogan.
Good afternoon. Welcome, Maria.
Thank you. Very nice to meet you.
Very nice to meet you too also.
Could you tell, please, about yourself, about your dentistry experience, about your practice?
Yeah. My name is Dr. Dohan Sahin. I am the oral surgeon. I graduated from the Istanbul University, the eldest, at the same time the biggest medicine faculty of the Turkey. I took my degree 2009, graduated. I started my education 2004. I took my master degree 2011 about dental implant surgery supported by the digital technologies. I am also using these technologies in my clinic. I work in Istanbul for 5 years. Then I moved to Antalya, and from 2016 for 8 years I'm working in my private clinic in Antalya, Turkey.
What kind of trainings and certificates do you receive and your team received?
I have about aesthetic cosmetic dentistry, lots of certification, also implantation. But the most important two certificates I can tell from Professor Alper from Istanbul University, bone augmentation, bone transplantation certificates. I am very proud about them. Also laminate veneers education from Yeditepe University, Professor Esra. Also about digital supported implantation, I wrote 96 pages thesis on this. Yes, actually in the people called this technology guided implant surgery or flapless surgery. With this way we are replacing the implants less invasive ways. Yeah.
Talking more about cutting edge techniques that you are using in your practice, could you say more what kind of advanced technologies do you use?
In our clinic, the most important advanced technology, as I said before, guided implant surgery. For that, we take 3D computer tomography from the patients. Also, we have intraoral scanners in our clinics. We take all of this data and we upload to this data to the computer programs. We are making surgery on a computer program actually. Digitally, we are making surgery during patients sitting at home, drinking his tea and coffee. We decide everything, how many implants, which angles, which size we will use. Then we prepare some placas special to the patients. When the patients come to our clinic, we fit placas and we send implants from that placas without cuttings. This is the most important technology we are using in our clinic, I can tell. Another, also we are using piezo surgery with ultrasound machines. We have lots of ways for cutting techniques for the bones, but with this piezo ultrasound technology, it's less invasive, less traumatic, and patients doesn't feel after surgery very big pain or swelling. Usually these piezo surgery machines throat, nose and ear doctors using for rhinoplasty, but we are using this technology also on dentistry. Yeah.
And what are the advantages for the patient when you are using digital implantology?
Digital implantology, it's actually all the surgery actually a kind of trauma. And we say if you are gentle to your tissue, to your body will be gentle to you. It's very big part of healing procedure. If you make more trauma to the tissue, to the bone, to your body during the surgery, your body will give bigger reactions to you. That's why we always try to make less trauma, try to be more gentle to our body, to our surgery areas. With digital technologies, it's possible. For example, if you want to send 4mm implants, normally you should cut 50mm area for that, just for 4mm implant. But with digital implantation, you don't have to cut very big areas. So with this kind of less trauma, post-operative turn, patients feel more comfortable, less pain, less swelling. And that's why we always try to use, of course, if it's possible with the patient.
You're talking about piezo now.
I am talking about the guided implant surgery. With piezo, usually we are using this machine for bone transplantation if the patient doesn't have enough bone in upper or lower jaws, for example. We are taking some bones from patient's jaw, especially the back side of the jaws or front side of the jaws. We bring this autogenous bone from the patients to the receipt area. We fix this and we are putting some artificial also bone graft. We are making mix from your body part bones and also artificial bones, 50%. We make mix and we are putting this. And during these surgeries, before taking the bone from the donor area, we are using piezo surgery with less trauma.
I see. And from which areas do you take the bone?
Lower jaw, the back sides, that area we say in medicine language ramus of the mandible or symphysis of the mandible, we call it, yes.
And it is restored with the time?
Yes.
This bone has a quality to restore itself?
Yes, restore itself also, yes. Also we are putting some artificial bones at these donor areas. But what is good with these techniques, actually we are not bringing 100% artificial materials from outside. Also something from the body. So it makes easier for accepting, for adaptation the new bone. That's why.
Thank you very much.
You are welcome.
It was
Nice
very
to see
interesting
you.
talk. Thank you.
You are welcome, always.